Hi, I'm Dr. Tracey DeLucia, and I'm currently a surgeon at St. Joseph's Children's Hospital in Tampa. And I started my training to get here back in Chicago, where I went to Loyola Medical School in Chicago. I then went on to do my surgical residency in orthopedics, also in Chicago at the University of Illinois. And then I completed my training in New York at the Hospital for Special Surgery, where I did a specialized pediatric fellowship in orthopedic surgery with emphasis in sports. My love is of getting kids and adults and myself in the game and keeping everybody able to play sports and practice through injury or whatever may come about. So I think the specific need of somebody who did sports medicine at St. Joseph's Children's Hospital was the main reason that I came here. So I treat everything from broken bones that you experience when you're on the playground to more complicated injuries such as ACL tears, patellar dislocations, shoulder dislocations, ankle sprains, basically anything that you can incur while you're doing an organized activity. The most common treatment that I provide is often just redirecting some exercises that people are already doing to make sure that they have balance in their muscles and they're stretching. But sometimes things are complicated and we need to do surgery on them, so I also provide surgical treatment for ACL ruptures, patella dislocations, shoulder dislocations, and common fractures. The nicest thing about seeing a patient who has an injury is talking to them about preventing injury in the future. So many of the injuries that I see could have been prevented ahead of time. It's simple things such as warming up before exercise, stretching out on a regular basis, or preparing yourself before you begin the season and not jumping into things. I also like to talk about some of the safe exercise guidelines, such as you should warm up each time you do an activity, you should maintain good overall health, you should have a good diet, you should absolutely drink lots of fluids while you're exercising, and most importantly, you should cross-train. It's really important not to do the same sport all year round so as to not overtrain some muscle groups. So a lot of times parents come in to me and delay care because they thought that the child was just having growing pains. What we really know now is there's really no such thing as growing pains. Children shouldn't hurt. We often find an underlying cause, whether it's an overuse injury, a small sprain, or simple nutritional deficits such as vitamin D deficiencies, and these things can all be taken care of. If you think your child has an injury, the first thing to do is make sure that it's not an urgent injury, something that needs to be taken to the emergency room or urgent care. But if it's something that can wait till the next morning, really just give the office a call, and we're happy to often see you that day or even the next day to get you in for some of these less acute injuries that don't necessarily need to go to the emergency department. Since I've been at St. Joseph's Children's Hospital, I've really seen how the whole staff really cares for kids. And I really think that it's a great place for you to bring your child when they're injured. We have a full range of staff that really knows how to deal with children in a very professional and efficient manner. That's why I think at St. Joseph's Children's Hospital, we have the right things to care for children, and it's really important to go to a center like that. I'm really happy with the care that I see patients getting here, and I've been really happy with my decision to work here.